Welcome to Inside Startup Investing, the only podcast where you can invest in every guest. On this episode, I will be speaking with Mark Holland, founder and CEO of Choose Your Horizon. Choose Your Horizon is a mental wellness company that offers at-home psychedelic therapy through certified medical experts for patients dealing with PTSD, anxiety, and depression. This was a fascinating discussion for me, and an eye-opening one at that. Some of the things that I want you to really listen to include, first, while psychedelics and ketamine have long had major negative stigmas surrounding them, there is a growing body of research and FDA approvals that show that psychedelics in low-dose, short durations can have a very positive impact on things like depression and PTSD. The second thing that I learned on this episode is that while you hear the word psychedelic and think of things you've seen in movies, what it really is a dissociative experience that allows individuals to almost have an out-of-body experience where they are observing themselves and thinking through underlying mental health issues with a more logical perspective. With guides on hand virtually, what it ultimately creates is a highly productive therapy session that helps individuals work through challenging topics in a far more efficient way. Lastly, this is a really exciting company that is growing fast and is led by an exceptional CEO that has already launched and exited a company that was worth more than $100 million at exit. Mark is a builder, and he is methodically building this business with over $1 million in 2023 sales, and they are on pace for some incredible growth numbers this year as they roll out to new states. So with that, let's get on to the show and welcome our guest, Mark. I'd love for you to just give us a little bit of background about yourself and how you came to found Choose Your Horizon.
Yeah, happy to. So originally from Ireland, got into kind of sales and marketing all over Europe, studied as an accountant for several years, and moved to the States in 2006 to follow a career in consumer health. Spent kind of 10 years building out a business in New York and Chicago. And it was essentially a nutraceutical business. In the consumer health space, we would have conducted about 12 clinical trials over the course of 10 years to prove our supplements worked. And we eventually sold that business to a Fortune 500 CPG company in the States. And I had kind of developed a thesis for just helping users manage their own health more effectively. And got very frustrated with the whole smoke and mirrors claims associated with dietary supplements, and the odds are just stacked against users. So I founded a company called Choose Health, which is a 50-state at-home blood testing business, just trying to make it really affordable and easy and simple for users to track their own health at home. So for $50, $60, you could basically get a full metabolic test at home. Built that out. Realized selling prevention was a really, really difficult thing to do. Getting people to care about their own health proactively is very difficult. And it kind of led me into, during the pandemic, the public health emergency enabled kind of ketamine therapy at home. And I'd been dabbling with psychedelics on and off for several years. Was kind of deep diving into the science and speaking to lots of people, going to conferences, and it was really that point that we had the infrastructure built out that we decided to kind of jump into at-home ketamine therapy as the next frontier in mental health.
For those who don't know what ketamine is, can you give us a little bit more background on what this psychedelic is?
Yeah, so ketamine is a compound that was originally synthesized in the 50s. It was kind of originally discovered for its use as an anesthetic. So it was approved by the FDA in the 70s as an anesthetic. It was used in Vietnam on veterans to basically get them back to bases, to treat them after they'd been seriously injured. And through, obviously, it had been noticed and observed that people were having pretty profound experiences when they would come around after its use as an anesthetic. And around the turn of the century, around 2000, the initial kind of clinical work started to come out on ketamine's use as an antidepressant and specifically anti-anxiety, anti-depression, kind of generalized PTSD. And so, yeah, over the course of the last 20 years, there's been a plethora of science. It can be used in different formats. So many people will likely be aware of its use in clinics and IV intramuscular injection, which typically is a longer experience. It's like a 2 to kind of 6 hour experience. It's a higher dosage, and it's traditionally used. It's used off label for the treatment of treatment-resistant anxiety, depression, PTSD in clinic format. The FDA actually approved a derivative, S-ketamine, which is known as Spravato, in the drug world in 2019, on label for use case with treatment-resistant depression. And so the work that we do is sublingual, so it's at home ketamine-assisted therapy. So there's a whole program around administering lower dose ketamine at home in a shorter acting duration. So it's typically a 20 to 30 minute dissociative experience where we've kind of curated a whole psychedelic kind of protocol at home to get the most benefits out of the system.
What is a dissociative experience?
It's obviously very difficult to standardize an explanation around it, but typically it's disassociation can be described as being outside of one's typical thought pattern. So outside of your traditional, essentially the way I explain it is it feels like you're observing yourself. It feels like an out-of-body experience where your kind of conscious train of thought is you're seeing it from a third-party perspective. So anecdotally, I mean, for me personally, it enables quietening of the mind and enables, things that are bubbling under the subconscious that might be presenting themselves in different formats. It enables like a much more logical approach to observing the stream of consciousness. Is kind of how.
And then when you talk about having kind of a, medically assisted experience, so on your platform, one can essentially log on, they take the ketamine and then have the ability to kind of talk through and almost have like an assisted therapy experience. Is that what it looks like?
We have a full medical practice across now 21 states in the US. So there's a full team of medical experts. There's a chief medical officer, her advisors. They're all medical doctors. And then under the medical group, we have psychiatric nurse practitioners that are all trained in psychedelic therapy. They're all trained in specifically with controlled substances and ketamine. And then under that, we have guides and therapists who are trained to actually sit with patients during the experience. So there's a full medical structure to both prescribe and then administer the at-home experience.
Something that I liked about kind of diving in and learning more is that, yes, you can get ketamine-assisted therapy, but in kind of these very cold medical settings that are maybe not the best environment to do these things in. And one of the major differentiators and things that you're doing is you're enabling folks to be able to do this at home, which provides better access and potentially a better experience as well. Can you talk a little bit more about kind of the thinking behind that and how you think that enhances and helps the experience?
Yeah, there's two massive problems. One is access to quality care. So less than 50% of US counties have psychiatrists physically present. And also most of the mental health care paradigm is centered around this Western approach of short duration consultations followed by standard medication. And so what we're doing is we are offering alternative treatments to mental health. So for people that have tried the existing system, a lot of our patients have been in that system for, decades, and they haven't gotten better. These traditional medications have a lot of side effects. They can numb people's kind of ability to be conscious and human over time. So it's just an alternative treatment, an alternative therapy. So yeah, we're enabling it at home remotely. You can get the prescription remotely. Our whole structure is about enabling an entry point to alternative treatments for mental health care over time.
Now, in kind of trying to learn more about this, I always like to ask people their thoughts on these new types of treatments. And in just talking with some friends and folks in our network, I think one of the things that comes up is like a barrier to folks adopting something like this is kind of a fear around the unknown. And you hear the word psychedelic and immediately maybe have negative perceptions. And it probably comes from just a lot of not understanding or knowing. Can you talk about some of those challenges and how you're trying to maneuver that?
Once somebody crosses that like knowing doing barrier, it's almost like there's no point of return. If you look back at some of the ads and some of the media exposure around psychedelics in the 60s and 70s, like the effort that the authorities went to bury psychedelics back in the day was pretty impressive, actually. I mean, the extent, and this has all been science driven, and this next wave is very much, I obviously wasn't around for the first wave, but like from my perspective, like it's very clinical in nature. The shows that I attend are very much science led and very much clinic led. And you obviously have to smoke the more sensational side of kind of psychedelics and psychedelic use, but I come at this very much from a medical perspective. Our protocols are completely created and driven by MDs, by medical professionals, and like we err very much on the side of caution with everything from dosage to at-home safety protocols to follow-ups. We're completely focused on clinical outcomes, so patient outcomes. But I think like with every kind of wave, whether it's kind of crypto or whether it's social media or whatever kind of wave is happening at the time, there's always going to be some adults in the room and then a lot of bad actors. So I think over time, like if you just take a pragmatic first principles approach to looking at the information and the data, it's staggering how much more effective some of these treatments and protocols are against the kind of the incumbent medication. So I think it's all time.
Yeah. Well, and I mean, one could argue, right, from the 90s to now, if you look at marijuana use, right, it was like this horrible, awful thing, right? And now it's pretty mainstream at this point. And it does take a lot of time, but little by little, these things do become mainstream. I'd love to hear a little bit more about some of those results that they have seen, in the literature, in science, research, what they have found with ketamine treatments. And then if you could even talk to, I know you can't talk about individual patients, but general experiences folks have had with, utilizing Choose Your Horizon to lead to better outcomes for their mental health.
There's a huge amount of science happening, like this second wave across, like a lot of the Puritans wouldn't even class ketamine as a psychedelic. So the science happening around, psilocybin, MDMA, LSD, like there's a huge amount of clinical work ongoing at the minute. But I mean, in the short term, so next year MAPS have an MDMA protocol for PTSD that looks like it's going to be approved in 2024. That's a pretty extensive protocol involving multiple clinic visits followed by multiple therapeutic kind of psychotherapy sessions around it. So very comprehensive protocols. I mean, again, you look at the results, the clinical results in comparison to the incumbent or the existing control medications, and they're 2 to 3 times more effective in fringe patients. But an order of magnitude in a clinical setting, like being like 30 to 50% more effective. So it's all really exciting. I think like in 2025, we'll likely see some medical protocols around psilocybin with compass pathways. I mean, anecdotally, our own kind of outcomes data is showing, so we've delivered, over 10,000 treatments across over 2,000 patients at this point. So we have substantial outcomes data, and outcomes data is based on, again, traditional reporting, which is like GAD, PHQ scales, which are, in my opinion, not a great way to assess somebody's mental health. It's like they're leading questions. They can be But these are the tools we use because it's what's kind of within the structure. But we've been able to show, like, within 120 days that there's been a 66% reduction in PTSD symptoms, 58% reduction in anxiety symptoms, 45% reduction in depression symptoms. Less than 1% of patients are having side effects. 98% of patients are reporting some improvement across the board. So again, in comparison with the existing treatments that have, close to 50% of patients experience side effects, and medication is typically only effective for roughly 50% of patients, there's no comparison.
Let's go to the business side of things. How are you charging for this service? And is this something that's covered by medical insurance right now, or is that something that's going to take time?
We do not accept insurance today. We are launching first 3 states for accepting payer insurance with all the big payers in May. So we are evolving. Basically, our whole mission is about scaling affordable and responsible access to advanced kind of mental health treatments and psychedelic therapy in particular. And so, yeah, insurance is obviously a big piece of the jigsaw today. It's all cash pay. We do finance programs for patients, so we offer close to cost-based programs for veterans. We offer like payment plans for everybody that we are trying to, again, follow our mission of being responsible and providing affordable access. So today it's we offer kind of 4, 6, and 8 treatment packages. Our whole thesis is medication in the context of healing. So we're not a telehealth kind of medicine mill. We're really using ketamine in the context of what I believe is like an opportunity to use this like period of neuroplasticity for patients to adopt new habits, adopt like better day-to-day kind of processes for themselves to improve their quality of life. So with us, it's kind of like we're really trying to build a mind-body, body-mind approach to this, where like for basically giving away metabolic testing, where if somebody's metabolic dysfunction is out of whack, it's almost impossible for them to have to be fully functioning from a mental health kind of perspective. So that's our whole thesis, is like between the 4, 6, and 8 session packages, people will have a guide who sits with them during every session. So they have somebody that works on the preparation, which is kind of we have a proprietary program around preparation, and then they sit with them during the experience, and then the patient will come back and they'll work on integration with them, basically integrating their experience so that they can then adopt these kind of insights into making positive change in their life.
Kind of hitting on that telehealth pill pushers that are out there. They obviously use very aggressive marketing, whether it's, the Rose and Hims of the world. So what has been your kind of go-to-market strategy in the context of really being kind of a thoughtful, we are here to provide better access to mental health care?
So first off, I kind of brought in a couple of people that I'd worked with in my first business, and I realized very quickly that this, like, the population base is very sensitive, that like we're the patient base, and so like really doing this, I really wanted to do this well, and so yeah, brought in a few folks that I trusted and I'd worked with in the past, and so yeah, we really just started initially with outcomes in mind. We're definitely the most cautious provider in this space. I would say not a jab to our competitors, but we err on the side of caution. I did not want to get into anything that I felt was unscrupulous, or I felt that we were, getting ahead of the curve from a science perspective, or that I wasn't able to stand behind personally from a patient outcomes perspective. Like, I really wanted to make sure I could scale my experience, or basically provide my experience at scale. But we're really intentional with allowing the practitioners, who essentially the medical group is owned by our chief medical officer, and we're very intentional to let the physicians kind of lead the protocol developments and to keep patient safety and protocols as our North Star.
You're currently raising money on Start Engine. What are you raising for? Where are those funds going to be applied to help grow the business?
Yeah, so we're currently on Start Engine. I think we're at about 600K. The goal is to get to about $1 million on that raise. We've only raised 1.7 kind of million total lifetime to generate 2 million in revenue last year, and projecting a multiple of that this year. So it's we've been very lean and very intentional about how we've kind of used funds and scaled the team and the processes to date. So yeah, we're using the kind of crowdfund as a bridge round really into a potential Series A next year or late this year, based on kind of this year's run rate. So we're using the current funds really. We're scaling from, we're currently at about 20 states, so we want to be in 50 states by the end of the year. And yeah, it's kind of scaling spend. Really, this business is about finding patients that are interested in our services and then recruiting providers, and we're the technology provider in the middle, essentially matching supply and demand. And there's obviously an upfront cost with recruiting providers and media spend associated with patients. So yeah, that's what we're using the funds for primarily, but we've also extended our team.
What does it take to enter a new market from a regulatory perspective?
It takes a lot of blood, sweat, and tears if you're doing it yourself. It was definitely the biggest learning curve for us. I mean, our background was in consumer health and nutraceuticals, so it's self-regulatory, so it's not true kind of medical infrastructure. But yeah, I mean, you look at the US healthcare system is state by state. There's obviously federal guidelines, and then there's state by state regulations. So yeah, it's finding the right kind of software providers, the right partners to help guide you through both legal, regulatory. There's a lot of paperwork and a lot of education that comes with having peace of mind in scaling out a business in this kind of highly regulated space. But a lot of the learning is up front really, and again, we were pretty cautious at the start. So scaling from 20 states to 50 states is infinitely easier than going from 0 states to 5 states.
As you think, call it 18 to 24 months down the road, what does success look like for you?
So I believe there's restrictions on what you're allowed to say in relation to the crowdfund. So I'll give you anecdotal kind of high level, but again, we want to be in 50 states. We want to be an order of magnitude or several turns bigger than we are now. As I said, we did 2 million revenue last year. We've just hit 10,000 experiences. So we want to essentially be able to kind of to show that we can scale this in a responsible manner. So at every point in our evolution, we stop, sit down with all the healthcare practitioners, look at our protocols, look at our outcomes, and make the stop, start, kind of accelerate decisions. So yeah, I'd like to think that we'd be able to offer other psychedelic compounds in the near future. We're working with a couple of pharma companies actually right now on derivatives of traditional psychedelic compounds that are more appropriate for at-home use. So yeah, I think just kind of scaling out the infrastructure, continuing to pass savings on to patients, and continuing to kind of provide value. It's as soon as we stop providing value and show that our outcomes data is not improving, or at least not maintaining the kind of status where we are, I think that's the point that we'll start to really ask ourselves questions. But there's so much room. Like really nobody that I've come across is doing metabolic health and mental health holistic treatments well. It's a really empowering kind of story that I continue to try and kind of build for the team.
Well, Mark, thank you so much for the company you're building. I think it is a really impactful, really important company that's kind of on the cusp of what hopefully will be a new wave of innovation in mental health treatment. Really appreciate what you're building. I certainly do believe there's a massive market opportunity for you all to go after and to build right into. So if you liked what you heard on the show today, you can check out our research on the company at Kingscrowd. and invest on Start Engine until March 31st, starting at just $280. And please like, subscribe, and share our podcast wherever you listen to podcasts so more listeners like you can find us.